Hey there! So it's me, Cameron, and I am going to be talking to you about medical marijuana. I asked Twitter, Instagram, and Snapchat, what videos should I make for my YouTube channel? Kind of like an introductional what's going on type thing. And this is the topic all y'all choose. So, here we go. Getting right into it, just give you a brief medical history on my part. 1 second, eggnog break. Alright, so I had brain and spine cancer. I went through 2 massive surgeries, got rid of it, went through radiation. I'm in my I'm in my 2-year mark. I'm still not technically cancer free, but you know what? There's a low chance that it's coming back. Anyway, I was a childhood epileptic. I hit puberty, got a set of boobs, and my seizures went away. Didn't really have to worry about it until the whole cancer scenario happened. And then after that was done, I was like, I'm done. I don't have to worry about that. I can be a 21-year-old and I can live it up. Sup, bruh? But no. I ended up having a seizure at work. And so now, my lovely face is diagnosed with epilepsy yet again. Well, technically it never goes away. Anyway. But where does medical marijuana tie into this? Unless you've been living under a rock, you know that marijuana helps cancer and seizure patients. And if you have been living under a rock, here you go, news to you, cannabinoids do help people that suffer from many different things like PTSD, anxiety, depression, eating disorders, and many other things, including cancers and seizures. Poster child for that. And I just want to talk about something real quick. I'm prescribed some 2 pretty heavy, pretty intense medication for my seizures. I am taking Keppra, 3 pills twice a day, and I'm taking Lamotrigine, and this I'm supposed to work up to. So my regimen for this is week 1 and 2, 1 tab daily. Week 3, 1 tab twice a day. Week 4, 2 tabs twice a day. Week 5, 3 tabs twice a day. Week 6, it doesn't say. Week 5, okay, week 6, 4 tabs twice a day. Week 7, 5 tabs twice a day. And then on my 8th week, I get bumped up from my 25 milligrams all the way up to 150 milligrams, and I'm supposed to take that twice a day. Keppra. Right now, I am taking 250 milligrams, taking 3 of them twice a day. That's quite a bit of drugs in my system. A lot of you probably tuned all that out. I know I did when I first heard that I'm going to have to be taking horse pills and narcotics, basically. I was shocked because I know for a fact that I can get a plant here in Bellingham, Washington, perfectly legal at my age, for $6, $6 a joint, and it would take care of my situation altogether. And that, my friend, is called medical marijuana. But for some unknown godly reason, the FDA has said that these pills are totally okay. But Blackberry Kush, Black Cherry OG, and my favorite, Supergirl, is not okay. This is not FDA approved. This is a gateway drug, and this is basically the devil's lettuce. No! Stop for a second. Okay, so, gateway drug. Not a thing. But before I get into that, let's talk about the side effects that I am going to have to deal with taking these things. And let's start with Keppra. So, Keppra can cause drowsiness, weakness, infection, loss of appetite, stuffy nose, tiredness, dizziness, and then sleepiness, occasional injury, hostility, see, seizure brain, can't say things, nervousness, and weakness. Oh, also, things I should look out for, hallucinations, bruising, severe tingling, numbness, pain, muscle weakness, feeling very weak or tired, fevers, chills, body ache, flu symptoms, sores in your mouth and throat, problem with walking and movement, first sign of any rash, no matter how severe or mild, and severe skin reaction, fever, throat, swelling in face or tongue, burning in your eyes, skin pain, followed by red or purple rash that spreads, especially in upper face and upper body, and causes blistering and peeling. That's just with Keppra. Okay, you want to get into lamotrigine, this pill right here that makes a lot of people go batshit crazy? Yeah, let's talk about those side effects. Serious skin rashes, hypersensitivity, body, blood, disease. Oh, that's nice. Suicidal behavior and ideation. Withdrawal seizures. So basically, if I don't take this one day, I could have a massive seizure. Oh, and my favorite, sudden unexplained death in epilepsy. So I could drop dead at any moment when I get this to full dosage. I love these. These are saving my life. Okay, let's talk about the side effects when you are smoking or eating or ingesting anything that has to do with medical marijuana. Let's talk about it. Munchies, severe tiredness. Yeah, because you're so relaxed you want to chill on the couch for a little bit. Did I talk about munchies, how you want to eat all the time? Or, positive thoughts, positive behavior, motivation to do things, antidepressed. Oh, and a sudden urge to be with nature. Now, what is wrong with that? Maybe this is me being a millennial. Maybe this is me being stupid and 21. Maybe this is because I'm a cancer patient and suffer from epilepsy, that I just don't understand why people are so against medical marijuana. I can understand if you're against it for recreational use. I totally get it. I hate seeing people on my Snapchat story who are just sitting there smoking weed because they want to get high and they want to run away from their problems. Go to counseling or something. Medical marijuana is not for you to just run away from your problems. Medical marijuana is for us patients who need it the most, who need to eat, who need to get some sleep, who need motivation to get out of bed and leave the house, who cannot be paranoid if they're going to drop dead at any moment. It is for people who need it the most, not some 17-year-old who just wants to get high and piss off their parents. I said it loud and clear, and I hope you listened, because it is kids and people like that who are making the stigma for medical marijuana so obscene that I can get in full-fledged arguments with people because they automatically think, well, my son got addicted to heroin because he was smoking weed at 14, so therefore he's addicted to that because of it. Your son was probably addicted to many other things, and heroin just decided to pop up because, the high was just not enough. And unfortunately, that is a very common thing. And that's not the weed's fault. That's not the cannabinoids. The cannabinoids are not in your brain to tell you, hey, this isn't enough. Go smoke and do crack. That's not what medical marijuana does at all. It helps people. And what blows my mind is that people are willing to throw up facts about how marijuana patients are suffering from this, this, and this, and how people are so sick and tired of pharmaceutical companies and how these pills are going to kill our nation. But the second that we bring up Blackberry Kush or Black Cherry OG, for example, and it's a no-no. I'm put in a category of I'm a stupid millennial and I have no idea what I'm talking about. And as you can tell, I am very, very angry about this because these pills are slowly ruining my life. I feel myself turning from my chill, happy-go-lucky self to a very angry, depressed person. And I've worked so hard for the last 8 years not to be an angry person, to be a happy person, to preach the gospel, and when necessary, use words. I try so hard to be that, but with these medications, I can't control that. But when and I'm going to shock people here, I know I am, my family's probably going to gasp at the thought of it, or people are not going to be surprised. But when I smoke weed, when I smoke marijuana, or if I eat a special brownie, or if I take one of those CBD pills that takes away all of the pain that's in my head and all the pain that's in my neck, I don't feel like an angry person anymore. I feel like a happy person. I feel like somebody who can get up and clean the house. I feel like somebody who can appreciate things more. And I wish people would just understand that. And I don't know, I guess I feel like I need to wrap this video up because it's already 11 minutes long. I am 120% behind medical marijuana. I've seen it change lives. I know it can. It changed my life, and it's changing my life right now. And I know this video is not going to convince people to be all pro-green, but I want you to do research. I want you to look up the pros of medical marijuana before you go and you vote no on it. And I want you to know what you're taking away from me when you say that medical marijuana is not okay. I want you to know what you were supplementing for a plant. These are pharmaceutical drugs that will mess me up for life. Give me a plant that can change and save my life. Can you look me in the face and tell me that that's okay? Take this away. If you can, good for you. But I'm not going to. I'm not going to sit down and be quiet about it anymore. I'm going to be loud and proud about it. So, leave comments down below. Tell me how you feel about it. And I want to have a discussion. I don't want anger. I don't want accusing words, even though there was a lot of frustration in what I just said. But I want you to come from a learning place, because this stigma of people with weed and stoned culture needs to stop. We're good people. We're wholesome people. And I know the world can be a really great place. We just need to stop worrying about a plant. A plant. Okay? All right. I love each and every one of you. You know that. And if you need somebody to talk to, I'm here. Your girl Cameron's got you. Feel free to have a discussion below. No hate, or I will block you. All right.